Hello, we are back. I hope everybody's having a good day. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. That's a mouthful at the end of the day, apparently. Tonight we are going over what does foam rolling do. Again, if you reference our YouTube channel, Total Performance Physical Therapy, or our Facebook page, we're now on Instagram. You can find a lot of foam rolling videos where I go over what foam rolling does, but I've never specifically broken out the question. So I got the question, so I said, why not just do a whole video on exactly what foam rolling does and why it's the preferred method for me over stretching and what benefits it has. So first of all, we're going to talk about foam rolling, and when we talk about foam rolling, we're talking about rolling on usually a spike roller. Now, if this is your first time you're ever foam rolling, you really want to have two foam rollers. You want to have a foam roller with no spikes and a foam roller with spikes. This is very aggressive right here. This is really going to get in and dig out the knots. And that's really the purpose of foam rolling, which is why a lot of people quit foam rolling, because they say it just hurts too much, I don't want to do it, and they quit. And the fact of the matter is that if foam rolling hurts, it means you should actually be doing it more, because there's some issues going on. There's some knots there that you need to get out. So it's important that you recognize that in the beginning it may hurt. Once you've done it enough, you're actually going to get to the point where you crave it, and you'll be able to actually tell things that are going to start to hurt before they even hurt. So really important, whenever we talk about foam rolling, this is the gold standard in foam rolling, something with spikes in it. This is the rubber roller, this is what we use there, but there's a ton of them out there. The one thing you don't want to use is a piece of PVC pipe. While that's a really good flat foam roller, it is not the same as having spikes. So you can use it, and there's nothing wrong with it, but a lot of people will come in and say, hey, you know what, I have a piece of PVC pipe that I'm rolling out with, and that will get into some of the knots, but not like an actual foam roller will. I also want to say that we are not talking about the stick. So the stick, if you've heard of it, you know exactly what it is. If you haven't, don't even worry about it. But the stick is just a little roll on a stick. That is not any sort of foam rolling. So why you do that before a race is basically to warm up. But it's not the same as foam rolling. It doesn't replace foam rolling. They shouldn't even be discussed in the same category. But I often get told that, oh no, I foam roll, I do the stick before I run, or I do the stick after the run. And it has nothing to do with foam rolling. So what does foam rolling do? So foam rolling is going to break up the knots. So as we've talked about earlier, and if you look again at any of our videos on YouTube, go to Total Performance Physical Therapy, you'll see that when we talk about foam rolling, we're talking about knots in the muscle. And knots are literally just balls that have of muscle that have gotten tangled up, or a very layman's term. There's a very scientific way to describe it, but that's how we're going to describe it. So anytime you're on the foam roller and you roll over some of these pain points, you're actually breaking up the knot. And I like to describe the knot as an onion, because when you develop knots, the knots have layers. So there's some that are very superficial and they have really no layers. So as you start to foam roll and you go across these knots, you'll find that, okay, you'll find a painful spot, but sometimes you'll go over it once and you won't be able to find it again, and that's okay. That means that knot was just relieved with just a little bit of pressure. But sometimes you're going to roll on it for 30 seconds and you're like, oh my gosh, that's so painful, and it doesn't want to come out. You're going to have to keep chipping away at this knot, because what happens is this onion that you have, that's the knot, you're going to slough off some of those layers, and then you're going to go do some activity and you put some back on. The idea is, though, if you're foam rolling every day, you're going to slough off, put a little bit back on, but then slough some more off, and then put a little bit back on, and then slough some more off, until that knot is gone. Depending on how long the knot's been there, it will depend on how long it's going to take to actually get rid of it. Now, this is important because when you go to strengthen a muscle, if there's a lot of knots in there, you're not strengthening the muscle at the appropriate length. You're strengthening a muscle that's shortened, a muscle that's not working correctly. So when you go to the gym and you're trying to get your max weight or whatever you're trying to do, you can wind up either hurting yourself or not achieving as many goals as you can if you have these knots in there. So it's really important that you get the knots out. they will catch up to you. So it's not like you're going to run and eventually like it won't give out. It will give out. So if you're like, oh, I'm just not going to do it, it hurts too much, I don't like it, that's fine. Know that it will catch up with you, because there is only so many knots your muscles can develop before they're like, no, we're done, we can't function anymore, and that pain becomes so great that you won't be able to run. And this could be months, this could be years, this could be days, it really depends. I've heard of people train for an entire marathon, get to the start line of the marathon, run 2 miles, and literally not be able to run anymore. And it's that intermittent knee pain, it's that intermittent pain that they have ignored the entire time they were training that gets them in the end. And that's where these knots are, and that's the point of foam rolling. That's what stretching doesn't do. Stretching doesn't break up any knots. You can't pull at the ends of a knot and have it break up. You've got to sit there and you've got to roll over it. Now what you don't want to do is sit there and roll over the same spot for 10 minutes. That's going to cause pain, that's going to cause discomfort, that's going to cause you to limp, and it's not effective. 20 to 30 seconds, nice and easy, and then you move on to the next body part. The foam roller should really touch everything, okay? Your upper back, your legs, front of your legs. You just don't want it to roll onto the neck, because that's not an effective situation. But anytime you feel knots, and you can get knots from sitting all day at work, you can get knots from working out. This isn't exclusively for people who work out intensely. This is for people who have jobs that put them in a computer where you're like this. Your muscles are not designed to sit like this. Your muscles are not designed to sit like this. In these postures that you have, you form knots. This foam roller is designed to break them up. And you have to do it on a daily basis. If it's the first time you've ever foam rolled, you're going to find a lot of knots. It's going to be really painful. It's going to be hard. But that's also the other good thing about foam rolling as opposed to stretching. It is easy to do foam rolling just for a minute, and then you take a break and you walk away. If it's extremely painful and you're rolling out your piriformis and it hurts a lot and all you can tolerate is just a little bit, great. Just do 30 seconds and then move on. There's no reason for you to sit there for 10 minutes and just hammer the piriformis. You still want to do it. You want to make sure it's done. But at the same time, you don't want to kill yourself trying to do it. When you stretch, you want to hold a stretch for about 30 seconds. Do it 6 times. That's been proven to be the most effective timeline to do and get an effective stretch. Foam rolling's not like that. Foam rolling's going to break up the knots, allow the muscles to go back to that normal length, and allow you to feel better. It's going to take some time. It's not going to happen overnight. You should start to see less pain with foam rolling within the first couple weeks. You will bruise. I understand. That's just because there's some increased blood flow in the tissue, so that's normal. So don't quit because, oh my gosh, you're bruising. Especially if you're using a spike roller, it's not uncommon to have some bruising. That's that breaking up of the knots. If you need to switch to that flat roller because you're bruising too much at the beginning, totally fine. Switch over to that flat roller. Make decisions that are smart, but continue to foam roll. Continue to make sure that this is an active part of your recovery. You cannot work out effectively. You can't even sit at your desk well without being able to foam roll and get those knots out. If you or someone you know is experiencing pain and wants a consultation with a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.